Hello, this is general medical conditions. We're going to go over gastrointestinal disorders for this week. So here's your PowerPoint that we'll discuss some items that we'll go over this week. So our focus is GI disorders. Now there's a lot of information to it, so we're going to hit the highlights. Hit the highlights with this one that we're going to look at in class on Thursday. So there's some common conditions with this, with gastritis being probably the most common one that you'll deal with is your stomach flu. You also have your heartburn, your acid reflux problems, even ulcers that you'll deal with, even with the collegiate athletes that you will work with primarily. Even high school athletes can have this. And if you're outside of athletic training, this is a common disorder. Food poisoning can happen to anyone, so you have to be able to recognize that. Irritable bowel syndrome and various other disorders that mirror that. There's several diseases of that nature, like celiac disease, and to just name a couple that could be associated with that you have to be able to recognize and make the appropriate referral if you suspect something of that nature. Constipation, diarrhea, you will see this and you have to recognize it. Is it a recurrence problem or is it just a one-time thing? Gallbladder disorders, or that gallbladder attack pain that you could have, or if you eat a certain food, you have that pain or a particular side. And of course, appendicitis are some common medical things that you will see that are not necessarily related to trauma. Rule of one, rule of two. These are primarily things that you'll be talked about when you are dealing with parenting issues about when to seek medical care. Diarrhea, for the most part, is rule one. If the patient, your athlete, has diarrhea, there's a problem somewhere. Well, you don't have to go too far, and you should do immediate treatment to correct this. You don't try to wait this out. Diarrhea would indicate you would have a problem that will lead to dehydration, so you need to correct that. Whether that's your over-the-counter Imodium, taking some electrolyte aspects, but if you have diarrhea, you probably shouldn't be participating in sport at that moment in time if you're having anything else going on with that. But diarrhea, that's a problem. Vomiting, rule one for younger patients. This leads to dehydration. Now, with your older athletes, such as as soon as you get into junior high and up, vomiting is not necessarily considered a huge issue, because if you look at or go down to wrestling practice, I would speculate someone's going to vomit for most practices. So if it's considered an issue, you have to look at for something else. But vomiting, it's a warning sign of problems. But if you're dealing with, in particular, young patients, elementary school age, vomiting is a problem. You need to seek further medical treatment with that to try to calm the stomach acids and primarily rehydrate the individuals. For older patients, even junior high and up, look for something else to be a red flag. You can even have patients with sinus drainage that are vomiting. So keep that in mind. So if it's a general stomach ache with anyone, look for something else to confirm if it's something else. Look for fever, weight loss, point tenderness, abnormal bowel signs. So you have to do your exam, see if there's really anything else with that. And don't forget your visual inspection of the place. Because when we're looking at this, you want to see the general issues. Is it a contagion or non-contagious thing? So sort of a thought process that I want you guys to explore a little bit further on your own. What is the difference between food poisoning and gastritis? So compare and contrast those things. They both have the initial presentation of potential diarrhea and vomiting, pain over the abdomen, but there's some key characteristics or difference. Please look that up so you can answer the quiz that'll be open starting on Thursday to answer that question. Because you look at it, you're on a road trip, how do you tell them apart? What are you going to do? Because if it's gastritis, this is a viral infection, this could be highly contagious and you don't want to go through the team. If it's food poisoning, well, we want to avoid what we ate and identify what that is just in case something else is transpiring with that. And with this, what are the confounding factors with IBS? So to come in with irritable bowel syndrome, you're going to have those stages of diarrhea and constipation repeatedly, and it's a very uncomfortable thing. So keep those in mind as the food for thought that you should explore deeper and look outside your resources so you're understanding those processes when we have our exam in a few weeks. So actual medical examination. So we have our quadrants. So when we take a visual inspection, are we looking at emergency or non-emergency thinking? This real key characteristic is mechanism of injury or what disease or illness that we're currently working with. Remember, there's a lot of things going on in your abdomen, and you have to be aware of what you're palpating. There is superficial and deep structures even to get to the organs. And remember, you have front and back. So this is our organs, all those things that we want to look at. Now, case in point, you can see my thing. If we want to get to the liver, we really got to get underneath the rib cage as we palpate to find those structures. Even the spleen up in here, has to be something that we have to palpate when we look at this. Remember, we have an anterior view and posterior view. So you have to be aware of where you're palpating, what other structures we're looking at. And regional view, posterior view. Keep in point your kidneys, and those aspects that come through here. So when we're looking at a view, is it normal patient over here, or do we have other items that we have to be very concerned about? So if you have an individual that was a dirt bike rider, has this mark into their internal organs, and they're complaining of a stomach ache, well, we have a mark here. And if this probably is a younger individual, are we having some tenderness and swelling and anything else? So that could be a potential emergent situation. And now we might be dealing with shock and all those other stuff, so we have to look at signs and symptoms. Now this individual here, this injury is directly related to a car accident. So just having that seatbelt secure them violently in the lower abdomen, well, that's something we have to be aware of. And these conditions do not come up immediately a lot of times. It'll take some time where you're like, all right, I have that immediate pain, and then it settles down. But that internal bleeding that could arise in a short period of time really can cause some problems. So trauma versus non-trauma. Is there swelling? Is there tendination? Is there herniation? This is a nice herniation right here of your umbilicus. That is commonly not caused from immediate trauma, but as umbilical herniation that you can have with a tearing of your fascial tissues of your abdominal muscles. Then also look at skin color. Yellowing of the skin, nail beds, and eyes, that's an indication that we have a liver problem. Also, with bile ducts that could be compromised with gallbladder attacks, can affect your skin color too. Now, depending on where we're at, this could lead to a low-grade temperature. This will lead to tenderness. This would lead to other symptoms. So that goes into a rule too, that know what this needs. We recognize that this is a problem. We have to go deeper with this. And also, with their traumatic injuries, there may be blood in the urine, so urinalysis, so looking at that. But there's other problems with our urine. It could be different colors. We're commonly associated with athletic trainers, looking at hydration status with urine, what color is that way. But if there's brown color in our urine, that's a problem. Or if it looks like coffee grounds, or heck, you could have kidney stones with stones being pushed out, and with that issues with our urine, with kidney stones. So keep that in mind, that we might have to ask those questions like, what color is your urine? Is there anything unusual with your, or a better open-ended question, is there anything unusual when you go pee? Is there pain? So they can describe, is there pain? Is there blood that they notice? Because a little bit of blood will actually show up quite well in the visual range. And then we look at, you got to listen and palpate when we get to the point after a visual examination. So you want to listen to each quadrant with your stethoscope. What you're looking at, be aware of your relevant anatomy. Are there bowel sounds present? Are they frequent or sparse? To hear bowel sounds, you have to listen for quite a long time because it takes movement. So keep that aware. Also, there's arteries and veins and stuff that goes through there. So if you're have your stethoscope over the descending aorta, you will hear blood flow and whooshing. So that's normal. So be aware of what you're listening to. Also, if you really have someone that is having an intestinal attack, you will hear that. It'll be quite intense through your stethoscope. Now, when you're palpating, make sure you palpate over the 4 quadrants. My preference, and what you'll find in most textbooks, you start in the upper right quadrant. You're looking at your liver primarily with that. But if something's really wrong with your kidney, you'll be able to palpate through the structures. You have to sort of hook underneath the rib cage and palpate through those structures. And you want to make sure that you're getting to all points of the liver to make sure that is normal. Also, if the kidney is really, really big, having some sort of infection or abnormalities, you will feel it through the anterior palpation as well. And then the upper left, one of the key things that you have to palpate there is the spleen. You have to get underneath the rib cage, and you have to palpate that to see if there's any swelling of that. Now that goes into their mononucleosis or any trauma that we have, severe trauma with any internal injuries. But you have to be able to recognize what the spleen is with palpation. Lower left, this is commonly where our intestines are, but keep in mind, especially with our female population, ovaries can be palpated and that can be quite tender. Also, kidneys can be palpated over in this aspect as well. You might have some referred pain to that point, but your key thing with this is going to be your intestines and ovaries that you're palpating. Then I usually go back to the lower right with my palpation. Right here, we're looking at the appendix and the intestines, ovaries, and also the kidneys are there. So keep in mind what your relevant anatomy that you're palpating, so you know what structures should kind of feel like as a normal aspect. If it's really like a large mass or a palpable mass, that's probably not normal. So in class, most of us are normal. So that's a good understanding point, like what this is normal. So when you palpate and that it's not normal, that will give you key things. Now, a key thing with the kidney, the best aspect to palpate this is on the posterior side. So one of the key things, if you suspected with a kidney problem, times the patient will present with low back pain, soreness, other issues. So I like to sort of pound on the lower bottom of your costocaudal angle and just really palpate and punch that through to see if that gives any pain. So if there's anything tenderness with that type of palpation, we'll go over in class. Well, it's probably not a back pain, a back injury. It's most likely kidney, and that can lead. And you have to correlate that with a rule two of finding something else that correlates with that. With your organs, you commonly use percussion to determine what those are. So we have that tympanic drum-like sound that is produced with over air-filled structures. What are air-filled structures? Well, yeah, your intestines typically are, unless there's a fecal mass in that or food, your digestive process. Keep that in mind. So special note to be made with percussion reduces pain. It may be the underlying inflammation of pain, so some sort of inflammation. So is there an infection on top of that? With that percussion, is there something else going on with that? So that'll give you a cue and clue what we're finding. Ultimately, we want to make sure, are we treating our emergency situations appropriately? Now, do we have internal bleeding? And with that, are we recognizing signs and symptoms of shock with internal hemorrhage? Because you have to treat those accordingly. We're not talking, in even particular, having a aspect being thrown through you, but know what? You could deal with that. And you have to be aware with your examination what you're palpating. And we'll go over some emergency procedures on Thursday in regards to this. Also, appendicitis could be considered an emergent situation. And unlike some of the textbooks that were initially taught, where it's saying, oh, it's got to be tenderness over the distal third of the or right quadrant, where McBurney's point was, it's not always the case. Case in point, I think it was 4 years ago now, I had a patient present with appendicitis with pain over his umbilicus, and it traveled and moved around. I referred him on to urgent care because I couldn't figure out what was going on. He had a low-grade fever, just wasn't feeling well. And what was unusual about him, his appendix was not on the lower right, but the lower left. So I had an unusual referred pain pattern, but that's not that uncommon because 10 to 20% of appendicitis conditions are kind of wavering on what side it is. Also, be aware of anything that's a prolonged condition that can cause dehydration. So if you've had diarrhea for repeated days, well, that could be turning into an emergency situation rather quickly. So keep those in mind as well. Now, for upcoming class, I'll highlight the PowerPoint from class. But here are 2 key websites that you should review that will help you out with upcoming class. And also, there's a code, stomach, for the quiz. Have a great day.